Hello and welcome to this presentation on mental illness and cannabis use taken from a neurological perspective. As you can see by the reference on the front page here, we're going to review an article by Epstein and Kumra about executive attention impairment in adolescents with schizophrenia who have used cannabis. Cannabis use has long been correlated with mental illness, with cannabis use disorder highly prevalent among adolescents with early onset schizophrenia. However, the basis for this comorbidity has remained unclear. Different theories abound, including the possibility that attentional impairment is a common risk factor that predisposes adolescents to both disorders. Attention is a behavioural and cognitive process of selectively concentrating on a discrete aspect of information while ignoring other perceivable information. Current models of attention show that it is not a unitary function, but rather the result of a combination of three different attention networks. Alerting refers to achieving and maintaining the alert state. Orienting is the ability to direct attention to sensory events. And executive attention refers to the efficient control of the attentional mechanism itself, i.e. shifting, disengaging, and alternating attention. In this study, these networks are evaluated using the Attention Network Test, or ANT. Previous studies have found a marked deficit in the executive control network and a less pronounced deficit in the orienting network in patients diagnosed with schizophrenia. Impairments in executive attention have also been found in both non-psychotic adolescents with cannabis use disorder and in adults with schizophrenia alone. The aim of the study was to investigate executive attention deficits in patients with early onset schizophrenia and cannabis use disorder. The hypothesis was that the presence of cannabis use disorder may moderate the association between early onset schizophrenia and impairments in executive attention. An exploratory aim was also to examine whether performance on the executive attention component of the Attention Network Test was associated with surface area in the anterior cingulate cortex, with the hypothesis that executive attention scores on the ANT would correlate with measures of surface area in the right rostral or caudal anterior cingulate cortex. A total of 141 participants ranging in age from 10 to 23 years were recruited from clinical programs at the University of Minnesota. Of the 141, 134 completed the ANT, and we can see in the table here the number of participants in each group. The Attention Network Test independently evaluates the three different attention networks we saw earlier: alerting, orienting, and executive attention. The ANT consists of participants viewing a computer screen like the one in the slide and responding to the direction of the centrally presented arrow by pressing left or right on the keyboard. Three different scores are calculated for the three different networks. Group differences in ANT performance for all three networks were analysed using a Mann-Covert test with the ANT network scores as the dependent variables and two factors, psychosis and cannabis use disorder, as the independent variables. Post-hoc pairwise group comparisons using ANCOVA were conducted with age and mean reaction time as covariates to clarify any significant main effects or interactions. For the exploratory aim of examining brain structure and executive attention impairment, MRI scans were obtained. The surface area in the right rostral and caudal anterior cingulate cortex were measured, and correlative analysis between these measurements and executive attention scores were performed. Statistical analyses were performed using SPSS. Table 1 shows the main effects of the study. The overall Mann-Covert showed a significant main effect across all of the conditions. Table 2 shows a summary of between subjects effects. For the alerting network, we can see a significant main effect of CED. For the orienting network, there was a significant main effect of EOS. For the executive attention network, there was no main effect of EOS, but a significant main effect of CED and a significant main effect of the EOS and CED interaction. After controlling for age and reaction time, which were found to be significant covariates of ANT scores, we can see that surface area of the right caudal anterior cingulate was significantly correlated with performance on the executive attention task of the EOS and CED group. The hypothesis that cannabis use would moderate the association between impairments in executive attention and early onset schizophrenia is supported given there was a significant CED and EOS interaction across all attention networks. This indicates the effect of CED on task performance is dependent on diagnostic grouping. Further analysis suggested it was the executive attention network, which is related to conflict resolution, that differed between adolescents with pure EOS and comorbid adolescents. This data suggests the presence of CUD does moderate the association between executive attention and EOS. The study also found a significant correlation between executive attention scores and the surface area of the right caudal anterior cingulate cortex after correcting for age and reaction time, with a lower surface area correlated with poorer performance on the ANT. This also supports the hypothesis that these variables would be correlated. There are some indications that executive attention deficits in the patients with comorbid conditions may indicate pre-existing vulnerabilities rather than a neurotoxic effect on the brain from cannabis use. These include there was no evidence of dose-dependent effect of cannabis use on executive attention performance. There is a relationship between anterior cingulate surface area and executive attention performance, of which cortical surface area is determined prenatally. And executive attention deficits have been associated with increased risk for several other neuropsychiatric disorders such as post-traumatic stress disorder and attention deficit disorder. The study does have some limitations. These include a smaller sample size and significant differences in group demographics, with the male-female ratio skewed differently for each group. The test-retest reliability of the ANT has been questioned previously in both healthy control and clinical populations. A longitudinal study found that test-retest reliability in a sample of patients diagnosed with schizophrenia was moderate, however was stronger for the executive attention score than for alerting and orienting, which supports this study. The cross-sectional design is a limitation in that it is impossible to draw any causal inferences about the effect on executive attention that cannabis exposure has. These findings suggest executive attention may be an important factor in adolescents with EOS and those at clinical high risk of developing schizophrenia. The ANT could be used as a diagnostic tool in determining risk to developing schizophrenia. Investigative study into executive attention and cognitive control is increasing as important predictors of achievement in healthy children. These findings may have implications for the way cannabis use disorder and/or schizophrenia is treated and diagnosed, with potential for more emphasis to be put on executive attention and brain structure. Future research could include increased research into brain structure and executive attention with focus on the right caudal anterior cingulate cortex, and further study on whether executive attention and cognitive control as predictors for risk of cannabis use or schizophrenia. Thank you for listening to this review.